What's up, everybody? So, Snowmageddon, it's over, but probably waking up stiff, sore from a bunch of the sledding you did, a bunch of the shoveling you did. I know I'm sore in my lower back and upper back because I'm not used to those things anymore, and I took some hard tumbles. So what we're gonna do is show y'all some stretches to do and some releases to do on those muscles to see if we can't help that out. If these help out just a little bit, or you kind of go back and you're still in pain, maybe some stiffness in there, come into the clinic. We may need to adjust you and do some soft tissue work at the same time because sometimes it's a joint and a muscle issue, but hopefully you can do some of these things at home and get you on your way to feeling a little bit better, okay? So first off, we're gonna start with our lower back. So we're gonna show you a couple stretches for muscles in through here and in that lower back to help release that. One is just this seated kind of pigeon pose that y'all kind of done before maybe, that kind of works these muscles that attach into the lower back. Common mistake though, is people get to right here and they kind of fold over. I don't want you to do that. So I want you to push down on your knee, sit up tall, and drive your chest straight forward. If I do this and all the motion comes from here instead of my back, I'm gonna feel that kind of in my booty and my lower back. And I want you to sit here for about 90 seconds. If you need to come out and rest for a little bit, then go back in, go ahead and do that. Just think about accumulating 90 seconds in that stretch. That's what's gonna take to kind of change that tissue and actually loosen it up, okay? So that's gonna get kind of this lower area. In the actual lower back there, what we're gonna do is sit down on the ground, take that leg, put it over our knee, opposite elbow on this other knee, and then we're just gonna slowly twist. With any stretch like this, you're not gonna force it, you're just gonna kind of lean into it. Then when your body wants to release a little bit, then you can kind of go in. And again, 90 seconds. Make sure you do both sides. Even though if you're not hurting on one side, go ahead and even it out. Might as well, right? Okay, so next thing you wanna do is release that area with some pressure point therapy, trigger point therapy, not just stretch that area. So come on down in here real quick. What we're gonna do is we're gonna put this ball right above this bump on our lower back, this SI joint right here, and put it right in here. We're gonna put our feet on something, like a chair, bed, whatever. Push this ball right in there, find a kind of sore spot, and then what we're gonna do is rotate our hips under and push our low back towards that ball. And we're just gonna sit there for about 20 to 30 seconds until that spot just kind of melts away. And then we're gonna do it again, maybe on a different spot, move it around a little bit, and there. All right, if you feel sharp pains, kind of move that ball around. Don't get it on the bone, all right? You're thinking on that soft tissue area. Now, with shoveling the snow, I know, sore through here. That's all these muscles, okay? So I wanna release those too. Simple things, you can probably guess it. What we're gonna do is pull this arm across our body, see it right here. What I want you to do is try to get that shoulder blade out of the way. Don't try to just twist. Pull that arm across, sit in that stretch for about that 90 seconds or so, all right? Simple thing with the release, just use that ball. I got a lacrosse ball here. You can use a tennis ball. Just back up against the wall. Put that right in between where the shoulder blade and the spine meet. Pull that arm across, find you a spot, let it melt, okay? 20 to 30 seconds, then move on. 20 to 30 seconds, move on. Hopefully that helps out with some of that lower back, upper back stiffness or soreness. If it does a little bit, like I said, or if it doesn't really help that pain much, maybe we need a little bit more attention in that area, give us a call to the clinic. All right, y'all have a good one.